Uh, Good afternoon. Thank you so much for joining us here at NSU. I'm Dr. Peter Caproni. I'm an associate professor in the College of Psychology, the Department of Clinical and School Psychology. I also consult and supervise at our NSU University School, and I'm director of training for our postdoctoral residency program. My co-presenters today are all residents in our postdoctoral program here at NSU. So I want to make a couple comments. If you could please hold your comments and questions until the end of our presentation, then we will enable chat at that point and be able to take some of your questions and respond to them. I want to tell you a little bit about Nova Southeastern University. We have a huge commitment to the training and ongoing professional development of mental health professionals. In particular, we have programs in clinical psychology, mental health counseling, and we have two programs in school psychology, a specialist level program and a PhD doctoral level program. If you have any questions or interest in those programs, please email us at psychology@nova.edu. psychology@nova.edu. Okay, we also have two very well-established APA-approved internships for doctoral level psychologists that are housed here at Nova. So today I'm going to introduce our presenters, and perhaps they can give a wave as I introduce them. We have first Dr. Elizabeth Hilsman, all residents here at the Psychology Postdoctoral Residency Program. Dr. Kimberly McGoy, Dr. Agatha Morello, and Dr. Natalia Lohman. Okay, so I'm going to, let's see, let me get this on, oops. Give me one minute.
Dr. Ann Morrow as well.
Oh, I'm sorry, we missed Dr. Ann Morrow. I don't have your picture. Sorry about that. I've got your picture now. So I'm trying to figure out how to put on our PowerPoint. There we go. Okay.
Somebody just said that they're not hearing any sound.
Really?
Yes.
Uh-oh. Okay, let me see. Unmute.
And then,
can you guys hear me? The co-presenters?
Yeah. Okay.
Other people are able to hear. Yep, I can hear.
Okay, so if you're having trouble with sound, it's coming from us. All right. Sorry about that. Okay, so we're here today to talk about how we can best support our kids' social and emotional functioning during this very unusual period of time that we're living in, this pandemic crisis. Dr. Hilsman will lead off and talk about her lived experience with parenting and teaching her children at home. Dr. McGoy will convince us that effective adult self-care is the prerequisite to effective child care. Dr. Morello will focus on how we can foster healthy parent-child communication and relationship. Dr. Ann Morrow will help us understand how to cope with challenging behaviors. And Dr. Lohman will explore ways to manage anxiety and maintain a semblance of calm during these times. So let me check and see if there's anything I need to, I think we're in good shape. All right. And I will moderate the panel and talk a little bit about resources at the end, and we will field questions when we're done with this part of the presentation. So, Dr. Hilsman. Oh, I'm sorry, I went too fast. Dr. Hilsman, you can go ahead now.
Hi, everybody. Thank you, Dr. Caproni. So welcome, everyone. We're so glad that you're here today. My name is Dr. Elizabeth Hilsman, and I'm a therapist, a teacher, and a mother. In the past, I've also been a stay-at-home mom and a homeschool mom. And I know that whatever your role is today, this is not an easy time. We're all cooped up together at home. People are feeling so anxious and uncertain about the virus, about finances, about work. So many stresses are on our plate right now. And when we're at home, without our usual support systems, maybe away from loved ones and the other communities important to us, we're all cooped up together. There's a lot of stress. People are trying to get work done, homework done, chores done, activities done, all together. There are a lot of sources of potential irritations and frustrations, and things can change really fast. 1 minute, everybody's peacefully playing and doing homework and working and baking cupcakes, whatever. The next minute, the internet goes out, siblings start fighting, the sugar spills, the dog starts barking, everything kind of breaks down. Someone is likely to have a tantrum. We won't say who that is or whether that's more likely to be a parent or a child, but both can happen. And the question is, how do we handle all of this stress well with so many expectations that are coming at us? It's important that we try to get this, right, or do as well as we can in this time, because there's so many opportunities too. Time to be together, time to help each other, time to understand each other and our kids, to talk, right? And to have a chance to model some of those great skills that we want our kids to learn, to be able to model patience, empathy, compassion, communication skills, and compromise. Some of those things we're going to be talking about a little more today. But I wanted to share with you some of the things that I've been using at home that have been helpful for me. Maybe they're helpful for you. I think the first thing for all of us is to think, what has helped us get through hard times in the past? For some people, that might be their support system, family members and friends reaching out. How can we still reach out to those people? For others, it might be hobbies like music, taking walks, exercise. For others, it might be their faith, beliefs, spiritual practices that are important to them. You can use all of those things now to try to cope with this stress, because our stress is our children's stress, right? And so we need to find out first how we can prioritize. There are so many demands coming from work and school, things people are telling us we have to do. How can we simplify, slow down, and really think about what's necessary and what's important to us? Right now in this time, we're in charge of our home, right? And our kids will do well when we're feeling relaxed and when we're trying to find things about our days to enjoy. So everyone needs to eat. That's necessary. Those things have to be done. We need to clean up. How can we bring the kids in and get them to help us, right? So that they know they're a meaningful part of the family. The other thing, what do we like? What do you like? If you like music, have a dance party every day. If you like art, do one of those guided museum tours that are available online. But you don't have to do it all. It's not the time you have to teach your kids another language. You have to introduce them to another instrument. Pick what's important to you and share your values and your goals with your kids. Another thing, connect. We really want to spend quality family time together to help our kids feel like someone's there to listen to them. So we want to create some of those positive family times to enjoy together, doing whatever you normally would do. If your child likes a certain app or a game, you can go sit down next to them and ask them to show it to you. If you enjoy taking walks, I'm enjoying watching a little baby duck in my neighborhood grow day by day. So I take my kids along and we do walks once or twice a day. Have those good times that you're going to look back on and say, we made the most of this opportunity, at least to be together. The other things, if they weren't necessary, if they weren't important to me, I try to let them go and not feel guilty and not feel anxious about it. And lastly, there are all kinds of opportunities for conflicts. And so we want to help our children problem solve. Maybe they're old enough to start family meetings where we can try to find a solution that's good for everyone. Doesn't have to be perfect. We get everyone's ideas. We pick one that seems to work for everyone and we try it today. Maybe tomorrow we find it doesn't work and we try something else. But again, we're modeling compromise and communication and problem-solving skills that are going to be so helpful for our kids. So again, we're trying to be that firm, kind leader that our kids need to feel safe right now. If we make mistakes, we apologize and we try again. Each day is a new opportunity to try. And I want you to take this moment to really congratulate yourself. You've already made it through several weeks of this. We don't know how long it's going to last, but you've already done it. That's an accomplishment. And take some time today to praise your kids for what they've done, adjusting to all of this. We'll get through this. And I'm glad that the rest of our team is here to give you some more concrete tips on how.
Thank you, Elizabeth. Thank you, Dr. Hilsman. And we're going to go on now to Dr. McCoy, and that is your slide.
All right. Hi, everybody. Can everybody hear me okay? Okay. My name is Dr. Kimberly McGoy. I'm going to be discussing a few things. One of the things I'm going to talk about is making sure that you're engaging in self-care during this time of crisis, then maybe taking advantage of some of the times that we have at home, and then also something that I'm going to be calling the information diet. So I want everybody to pay particular attention to this picture and the quote that's on there where it says, "You're no use to anyone if you're running on empty. Caring for yourself first is often the best thing you can do in order to help others." And that is not selfish and it is not egocentric, okay? We have to put our own oxygen masks on first and make sure we're effective for our kids and for other people that we're living with. Now, as psychologists, we're always really aware of what we're giving to our patients at the expense of our own well-being. And you all need to be aware of that too, about what you're giving to your friends, to your partners, your parents, your roommates. We can only be effective in helping and being present for other people if we're giving ourselves the space as well. And during this time of crisis, this is extra, extra important. Now, I know that carving out time for yourself right now may be a little bit tricky. So there's going to be some ways that we can work around it. If you have the ability to find kind of like a quiet space for yourself to listen to music, a podcast, a book, or to just sit in silence, even if this means going to your car and just sitting there for 30 minutes, there's an opportunity also for us to kind of set boundaries with those that we live with, right? And I'll get into that more on the next slide as well. If you can't make time to be alone, maybe you're a single parent, maybe it's just not possible with everything going on, try to schedule really pleasurable and relaxing activities with your kids, right? Play a book on Audible. There's a lot of free books that are on Audible right now that you guys can sit back, you can listen to. Bake, like Dr. Hilsman was saying, go watch that baby duck grow, watch a funny movie, do a puzzle, do something like pleasurable with your children. But also remember, things may not go planned. So we really need to adjust our expectations for ourselves and for the kiddos. Everybody needs to understand we're not just working from home or having the kids do homeschooling. We're trying to get our normal stuff done while in a crisis, right? So it's not that we're just doing these things from home and trying to get them done. This is all happening under a very, very unusual circumstance. So you guys need to know that it's okay to not be okay. You may start the day with some beautiful schedule that you set, and then like Dr. Hilsman said, everything goes haywire, right? The internet goes out, somebody's throwing a tantrum, parent or kid, who knows? But we have to know that that's okay. You can't do it all. It's only natural, though, for us to compare, right? There's a lot of this comparison anxiety going on about how are you quarantining? But guess what? There's no right way to quarantine because we've never done this before. So give yourself the permission to break the routine because I guarantee it's going to happen. And you really want to be very patient with yourself and your kiddos about breaking the routine and try to avoid looking at other people and saying, oh, they're quarantining this way, they're learning a new language, they're working out every day. That doesn't need to be what you're doing, okay? We don't have to be doing it all. And again, there's no right way to quarantine. Okay, so on the next slide, I really think right now, because we're all kind of stuck at home, we can take advantage of this time together and we can really model adaptive behaviors to the kids and the adolescents and maybe the parents and other adults that we live with. So one thing I think that we all struggle with in normal times and now is setting boundaries. Okay, something that you guys can do is to really take the time to talk about what you need and how to set appropriate boundaries with people while also not violating the needs of others. And this may look like giving the kid or adolescent kind of to say, look, like, I need 30 minutes away from this schoolwork. Let me play 30 minutes of video games, and then I can come back to the schoolwork. And it's the same thing for parents, right? We can tell all the kids in the house or whoever we live with, I need 30 minutes, like 30 minutes of quiet time, and use that appropriate language, right? Use your I statements. Really try to teach your children how to ask for what they need and to really praise them for doing that, for using their words rather than their actions, okay? Now, I know that tensions are going to be high, but the key word here is to compromise. We all have to come together as a group, whoever you're living with, and compromise with each other, right? This is really going to be an opportunity to model effective ways of resolving conflicts, resolving fights, and my fellow colleagues are going to get into more managing anxiety and behaviors. But again, this is an opportunity. So let's try to kind of change our lens and how we're looking at this and take it as an opportunity to help teach our kids and whoever we live with about boundaries, about appropriate modeling. Okay, and the last thing that I really want to touch on is something that I have found to be particularly important, not only for myself, but for my patients, for my colleagues, for my family, is the information diet, right? There's a really big difference between being informed about what's going on versus gorging on that information, okay? Know the basic things that you need to know. Is your county on lockdown? Is there a shelter in place? Where can we go to get food? Do places require a mask? Updates on vaccines or testing sites. Those are things that we need to know, right? It's our responsibility. We need to be that gatekeeper of information for ourselves and for the kids. All the time, every day, we're getting all this information about COVID-19, all these different things that sometimes we need to push to the side or ignore. So make sure that you do your research for yourself, that you know what is true. Make sure you know what's actual facts versus the false information that's coming out, okay? And talk to your family about it. Try to answer questions that your kids may have or other people in your family may have. So really, really important during this time is to really stay informed on what you need to know, stay safe, and educate those around you to make sure that they're safe as well, okay? And that's all I have for you guys today.
All right. Hello, everybody. I'm going to talk. My name is Dr. Agatha Morello. I'm going to talk a little bit about what does parenting look like during a pandemic, right? And as if parenting isn't difficult enough where we don't get a prescribed manual for each child that we have, now we have to do this during a pandemic. And what is that going to look like for our kids? So there's definitely going to be some adjustment difficulties. We're going to see increased stress, for all family members, including for our children. We're going to see an increase in irritability, lack of sleep, maybe more nightmares, right? Restlessness, anxiety, some sadness, some increase in tantrums in our little ones, and maybe even some clinginess, and or our children following us around the home. This is why routines are very, very important, right? And this is when we think about routines and we think about setting a sense of structure, this will allow our children in a time of unknown, of not knowing what's going on. It'll give them a sense of normalcy, right? And it'll help them feel safe. However, I do want to acknowledge that what we're going through, it's not normal, right? So I want you to keep that in mind. You want to be structured, but you also want to emphasize that nurturance, the connection, right? And just the play in your child's life above all else. So how are we going to do that? How are we going to foster this healthy parent-child relationship? So definitely when we're looking at the connection between the parent and the child, that is one of the most powerful protective factors to leverage during this time of stress. You want to spend that quality time with your child. It's very crucial, although I do understand that on some days it seems almost impossible with all the things that we have going on. So you definitely want to set aside some special family bonding time, right? Like family dinners, maybe like my previous colleagues have said, baking together, doing activities together, art projects, going out on walks. You also, if it's hard for you to set aside that time, because I know some of us are trying to manage working from home while our children are home, you also want to take advantage of the activities that you already do, right? And you want to make them fun and special. So if you already know that you have bath time coming up, maybe let's take out some toys and let's have fun during bath time. Maybe if you already have a designated playtime, maybe do something special, build a pillow fort together before you watch that movie. And then increasing the bedtime routines, like increasing more fun activities during that time. So maybe coming up with a song while we're brushing our teeth, or as we're getting ready into our pajamas. You want to communicate with your child effectively, right? Even when you're frustrated. And this goes a long way. And I think a lot of us here can attest to getting frustrated on a day-to-day basis with not only what's going on in the world, with the changes as they come up. And it's important for us as parents to remain calm and cool and collected so that we can better model how to cope with frustration to our children. When we're able to communicate with our child effectively, we're able to avoid getting into these power struggles that we get sometimes with our children. It helps our children feel heard and understood, and it further enriches that bond with your child. So now I'm going to move into talking about what does that connection look like with preschool and elementary age children. So these are very young children, right? We want to make sure we validate how they're feeling. And if you see on my slides, I have different examples as to how we can do that. So for example, the child here is named Lisa. We could say, Lisa, mommy sees that you're frustrated. I'd be upset too if I couldn't go see my friend Pam today. So we want to be able to validate their feelings, right? We want to prompt a coping skill or a solution. Children this age, this young, they don't really know how to cope with their frustration that's going on. We want to be able to help them in navigating how to manage those big feelings that these kids are having, right? So Lisa, remember, you can calm your body down by doing some deep breaths. You can ask for a break. Do you want to try together? So you can model that for them and co-regulate with them. You want to be able to walk away and redirect your attention. And this goes back to my point about keeping your cool and making sure not to engage in that power struggle with them, right? So sometimes our children are very frustrated and they just insist on what they need, right? So we can approach them and say, you know what, when you're ready to slow down and make a choice, I will be here to help you out. So almost recognizing that you're seeing that they're frustrated and they keep going at it, but you want to make sure that they slow down and that you'll come back and you'll talk to them. And then definitely we want to praise your child's ability to regulate their emotions, right? So Lisa, I love how you just calmed down, and now you can go ahead and do your homework activity, or you can make this choice. So we definitely want to praise all their efforts. And now moving on to what does this look like with middle and high school age children, right? So when we're looking at the differences between younger children and older children, you know, for them, they might understand a little bit about what's going on in the world and understand that, okay, now I have to be home, I can't see my friends. But maybe, you know, it would be important to spend some time to educate them, developmentally appropriate, of course, using terms that they understand. What is social distancing, right? So they might understand what it is, and okay, I can't go to school, I can't see my friends, I have to maintain a 6-foot distance, but maybe they don't understand why it's important, and that's frustrating, right? Not being able to see their friends. So we can use developmentally appropriate ways to educate them on what is social distancing and why it's important to maybe not see grandma that weekend because we're trying to keep grandma safe. You also want to validate this sense of loss and disappointment, frustration about not seeing their friends. So when we're thinking about middle and high school age children, it's developmentally appropriate for them to want to see their friends. Like social groups and social interactions for them are so important, and they value that very highly. So you can imagine at this time, they must be extremely frustrated or disappointed not being able to see them. So you want to be able to listen to their concerns, their feelings about what it's been like for them to not maybe hang out with their friends or not maybe spend that, you know, go to that party that they were really looking forward to. And you want to make sure to problem solve with them, right? And on how to make this time easier. So maybe me being a little bit more flexible with screen time to allow for Zoom calls, right? So having a Zoom party, like my other colleague suggested, having maybe Google Hangouts where they can have like a Netflix party together and watch a movie. We also definitely want to encourage healthy habits. And now the difference between this age group and the younger age group is, as we know with our little kids, we are the ones feeding them, bathing them, making sure that they go to bed on time. But when we get to middle school and high school, there's a sense of independence when it comes to these areas. So we want to make sure that we are still giving our children that level of independence to care for themselves, but definitely monitoring what they're eating, how much physical activity they're getting, and as well as making sure that they go to bed on time and they're following a healthy sleep hygiene. And then just lastly, sometimes just preteens and teens, they need some space, and that's okay. This is a very difficult time, not only for you, but for them as well, especially if they were really heavily relying on their friend group for support. Thank you, everyone.
Hi there, good afternoon. I'm Dr. Annie Morrow, and I'm going to give you guys some of my favorite tips for managing behavior. And so I know that Dr. Morello was talking a little bit about communicating. And my view is that when children are doing things that might seem frustrating or challenging for us, I think that this is their way of communicating their wants and needs. So I'll give you an example. I walked by a park and I saw there was police tape just closing off the park. And my first thought was, oh my God, look, this is awful. And then, I thought about it and I was like, oh, well, it makes sense. And then, maybe out loud, I said, oh man, that's a huge skill that only a person that's older would be able to think through and then control. Sometimes a little kid might just walk by and see that the park is closed and just throw a tantrum. They might say a whole bunch of complaints. There might be other things, and parents are trying to deal, I think, more with these behaviors during the quarantine sometimes than ever before. And so, I'm sure you're thinking, oh, here's the lady from the university talking about behavior, and now it's time for the timeout slide. So we're going to talk all about timeout, and we're not. We're going to talk about time in, which I think is for me the most helpful first step. And I've gone over this with, grandparents, teachers, moms, all different kinds of people, and they've always told me that this slide is really, these skills are what they use and that have really helped them. So I have right there 5 different ways, PRIDE, if you look at my image here, and it's praise, reflect, imitate, describe, and enjoy. And these are ways to give attention to your child. And so these are ways where you're looking, you're scanning, you're looking for something that they're already doing right, and then you're going to go ahead and jump on that. So I'll give you some specific examples. What we mean by praise is a specific compliment for appropriate behavior. So something like, wow, Lucas, I love how you're playing with the iPad, so gentle. Or I might use a skill which is called reflecting or mirroring, or like my little image there, parroting the speech of the child. Maybe a little boy says, I'm putting the blue block on top of the yellow block. And the parent says, that's right, you're putting the blue block on top of the yellow block. Imitating is another way to pay attention. It's the same idea, but it's not with your words. So if you had your own set of blocks and the child was playing with blocks, you could put the blue block on top of the yellow block if that's what they did. In the little image there, the little boy is smiling and the mom is smiling. The little boy is facing one direction, the mom is facing one direction. She's mirroring what he's doing. I have the little image of a sports commentator there. I love descriptions because sometimes if I'm just compliment, it kind of feels fake. So maybe you use one compliment like, wow, Lucas, I love how you're playing with the iPad, so gentle. And then instead of just doing, I love, good job, you could use a description and you could say, you push the button so softly. So I think that what you can see there is that you can switch it up with these skills. And the last one is enjoy. And so what I mean by enjoyment or enthusiasm is that, here the mom is sitting with the little boy or little girl on the floor, and that they're enjoying in whatever moment they're able to have, sometimes playing, sometimes you're busy doing something else, but you can just take a moment to just enjoy. So for example, if I'm with a little kid and we're playing with bubbles and we're having so much fun, if I have 2 sets of bubbles, I'll blow bubbles too. And I'm smiling and I'm laughing and I'm trying to catch the bubble on the wand. And I think that enjoyment, sharing with the child can really help to reward the child for when they're doing something right. And so I know I gave all of these examples, and ideally you would be, able to use some of these skills playing with your child, maybe 5 minutes a day or more, just focusing on using these kinds of skills. But I find that it's really helpful to use these skills, even if, things are a little bit hectic. Maybe you're on your computer and you're working, you're not able to do all of this at once, but you might glance over and see, oh, what is Lucas, what is this little kid doing right now? What can I compliment, or what can I pay attention to? Next slide. And the way that I view all of this is that's your focus. You're paying attention to the child, and this is where you're shining your light. And so where do you want to put your light? If you put your focus on the behaviors that you want to see more of, what we see, some of the families that I've been working with, in my own experience, those behaviors, they expand. The kid does more and more because they're looking to get your compliment. Sometimes when kids are doing frustrating things or challenging things, it's this knee-jerk reaction to say, no, stop, put that down, but don't push the button like that. And you get in this negative cycle, and then the kid is working to get negative attention from you. So we can go to the next slide. And I've talked about a ton of really warm and fuzzy ideas, but for me, sometimes the warm and fuzzy stuff, it really helps, it contributes, but we'll be in the middle of a project. Some of my colleagues have talked about art projects or baking. You'll be in the middle of a really great activity and things will just go totally sideways. And there's a big tantrum or there's a lot going on. And one of my favorite tips for you guys is to have a laundry basket or a bucket nearby. So I'll give you an example of a time when I didn't do this. I was working on an art project with this really shy little girl, and I brought in, stickers, and I brought in like a shoebox, many crayons. I brought in all of these different things, and I carried them into the room. I did not have a laundry basket. I did not have a bucket of anything to do. And in the middle of the art project, this normally very shy little girl had a really bad tantrum. And there were these little stickers, and they were, I remember it like it was yesterday. They were shaped like little letters, very sticky. And she threw them all over the room. It looked like alphabet soup. And in the middle of it, I was trying to take some of the materials and just put them outside the door, but I had to go one by one. At first I was taking out the crayons, and there were so many crayons. We didn't need to have that many crayons with us at the table. So I was doing this, and it was just very slow. And so in the future, I was thinking, okay, I'm going to carry everything to the art table in a little box, and then take them out in a box, a bucket, a laundry basket. And then that way, if I need to get things out of there in a hurry, I can just pack up the laundry bin really quick and then just put it outside the door. So I found that really helpful. That's my backup plan. I don't know what your backup plan is. And it's totally okay if, me talking for 5 minutes about behavior isn't enough for you to get a really good one in place. Dr. Caproni at the end of the webinar is going to give a ton of resources. And there's a lot of really good information in there for you guys who might want to connect with, more resources to work on this. So that's all I have for today.
Hi, everybody. My name is Dr. Natalia Lohman, and I will be discussing some really simple and practical ways to help your child feel more safe during this time of stress and uncertainty. So, kids need some essentials. So what I'm going to talk about today are a sense of safety, routine, and lots of opportunities to play. So one thing that I want to begin with that I feel is so important is creating an organized space for your children to feel safe and secure. The American kid has 150 toys, so we really want to keep a decluttered area for them. It creates a calm space, which will send that nonverbal message that I am secure, I'm safe, I'm okay, everything's in their place, that nonverbal message to kids. And you know, children are so observant, they really pick up and absorb cues in the environment, and we want to foster one that's not triggering to them. And this is one of the small things we can control during this crisis that can really have a big impact on a child's sense of stability and security. And this can also really be made into a fun activity with kids. They could be involved from the beginning. And if they're involved in organizing, they'll feel ownership over the project and more inclined to keep things tidy. If they're participating, you know, let them know every toy has its home, every toy has its place, and this really helps children to create order in their life. And if they know what they want and where to find it, they can do more things on their own, which kind of frees up some space and gives for us, for you guys as parents, which gives them a great sense of independence and self-esteem for the child. Next slide. So another recommendation to help children battle the uncertainty of what might happen is really creating daily rituals. We know that children crave rhythm. Consistent routines, rituals, and structures really help kids feel safe, so they can lean on these and really rely on them. It's super important to create simple rituals and a rhythm for children so they don't spin out, right? We want them to stay in orbit. We don't want them to spiral out of control. And one way we can do this is to create a roadmap for the week. For example, what's going to be the routine for getting up out of bed in the morning? What does their class schedule look like on Zoom, perhaps? What about the meals for the day? What about the bedtime routine? This is another area where children can really be involved. They can help with setting up, clearing up, helping with making food and things like that. And once you do create this simple rhythm, repeat it every day so that the child can have a picture of what they will do next in the day. They know when recess is coming, when they're going to get a snack. And when a child has a picture of what comes next and then it comes true, it signals to the child that all is well. It's kind of like putting a little stepping stone in front of them that they will step on. And if we have that rhythm throughout the day, children will behave much better, right? That's what we want. It gives them the security they need to get through and make what you need to do as parents a lot less stressful, hopefully. Also, we should gently let children know about changes to their routines ahead of time, whenever possible, so they have some idea of what to expect. So we won't always be able to do this perfectly at a time like this. But whenever possible, we should give them a heads up in advance about any shifts that might be coming up or any shifts that may occur. And it's also important and would be really good to provide them with limited choices. So on the one hand, the child really gets to pick something that they like. And on the other hand, you, the parent, really maintains that control. So it's a win-win, just how the teacher's in control in the classroom. So when children know who's in charge, their nervous system really calms down. And when the parent is in the leadership role, the child knows all is well in the world, I'm in my place, things are okay and things are normal. And children feel safe not just when they can rely on our leadership, but also when they feel connected to us. This is something that we've mentioned a couple times already. So I really just want to drive this point home that as parents, you can increase your child's sense of safety by providing daily opportunities for connection. So especially in a time like this. So as we create this new rhythm that I'm talking about for our children's days, we must make sure that we're incorporating daily rituals of connection. So something as simple as eating dinner together, story time for everybody, or another activity to make this time period meaningful, like making a COVID time capsule, for example, maybe filling a shoebox with special memories, pictures, newspaper clippings, artwork, or journal entries from this time for them to look back on. And so we've been talking about creating a schedule, right? A rhythm, but it does not need to be exhausted. Every minute, does not need to and cannot be planned. The last recommendation that I want to talk about is to allow children a space for an emotional release. So if a child usually has after-school activities like sports and clubs, you can maintain something in that normal afternoon slot, but really scale it back. Let it be a time when children can decompress. They've had a lot on their plate throughout this time and throughout the regular school year. So another thing I encourage you to do is to really reframe the way that we think about boredom. It can really be a gift, right? So out of boredom and free play comes creativity. So if we can be okay with them being home and being bored, then you guys, the parents, don't feel you need to entertain them all the time, and that's okay. You don't have to turn into an entertainment director at this time. That would be impossible and very stressful. And just watch children when they're bored. Their muscle tone loosens. It's really a doorway to relaxation that then lends to creativity. They will begin to start looking for things to do, start to put their own imaginations at work. So if you can have the confidence and can tolerate that discomfort of leaving them bored without sticking an iPad or a tablet in front of them, they will start to go into deep creative play. And that's really the way a child digests the world and releases emotions like frustration and anxiety that might be building during this time. And this will give them time to recover from the stress of this virus. And these are just 3 simple ways to help you really help your child cope with, the current situation through really creating a calm, safe environment through a daily rhythm and ritual, and just allowing them that time to release and decompress. Thank you.
Thank you so much, folks. Those are some great tips, and I hope you guys enjoyed that. I don't want you to take away the idea that, you have to do all of these and be some kind of a perfect parent. One of our famous psychiatrists was David Winnicott, who introduced the idea of being a good enough parent. And that's that this perfection thing just isn't achievable for any of us. And as you heard several times, particularly in this time. I'm going to talk a little bit now about some resources that we have available. The National Association of School Psychologists website is here. You guys can take a screenshot. You can take a picture with your camera of these. This will also be on our recording that's going to be out there. The National Child Traumatic Stress Network, CDC, the APA, SAMHSA. And then for those of you who are local here in the Tri-County area and some of the upper counties in Florida, and I think this is generally available in a lot of other places too, call 211 and you can get through to a lot of very useful information. Some more resources here, SAMHSA's Disaster Distress Helpline, 1-800-985-5990. The American Foundation for Suicide Prevention has a toolkit that is very helpful. We talked about 211, the CDC on stress and coping. Florida Council on Compulsive Gambling has resources. And then here in Broward, our Henderson Behavioral Health Program is operating with telehealth. There are some situations that may rise to a crisis level, and we want you guys to know that there are available things there too. The Suicide Prevention Lifeline, the crisis text line, you just text HOME to 741741. And you can ask Siri or Google, what should I do if someone is threatening to hurt themselves, or I feel that way myself? And you will be connected to the Suicide Prevention Hotline. So I see we've got a couple questions. Okay, and basically questions in terms of how we get access to the information. I'm going to leave that for Carlos at the very end to be specific on, but I would ask you at this point in time to open up for any specific questions about the content. Let's see. Good to see you, Riley. Riley's one of my students from a couple years back. I'm glad Virginia has you. All right. So do any of our panelists have any comments that they would like to kick in at this point? Yeah, we've said all that we have to say at this point. If you can read him, let's see.
There's a good question I think maybe Elizabeth could answer.
Okay.
Yeah.
How about it, Elizabeth?
Is this the one about for parents who don't already have routines and everything, how to reset and start over? I think the great thing about children is that they follow our lead. And you can make a change from one day to the next, and the kids are going to follow. You know, I mean, again, it depends on their age. The younger they are, the more flexible they are. The older they are, maybe the more buy-in you need to get with a family meeting or something, and encourage them to come together, get a poster board, and try to write down what everybody wants and be collaborative about it. But I think we really want to encourage parents to have that strong backbone of being a leader, again, firm but kind, and growing into this new role of owning it, you know. And I know it's a challenge, but I think, you know, we really want to support parents to be the kind of leader who can start something new and not to be afraid to try something that may not work the first time and then try something else.
Thank you, Elizabeth. We had an interesting question, and I just lost it here from
I saw it. It was a question. It was a question from, I believe, Marsha, saying, "What if your high schooler wants to vegetate in their room all day?" Yeah. And Dr. Hilsman, add if I'm missing out, because I know you have high schoolers at home. I think going along with, you know, acknowledging that they are at a place where they want some level of independence, but also knowing that you, as the person who is, you know, coordinating all the things that they need to do, maybe sitting down and having a meeting as far as what your expectations are of them throughout the day and what they would like to do, so that you can come to a compromise where, yes, okay, you can vegetate in the room, but first maybe let's go for a walk. Let's make sure that your schoolwork gets done, and so forth. So having a balance at this point of the two. Because I think either extreme is what we're not aiming to do. So I don't know if Dr. Hilsman, you want to add to that?
Yeah, I think you mentioned two really good parenting principles. One is earning your rewards, right? Okay, if this is rewarding for you, what do you need to do first? That first, you do what I need you to do or what your teacher needs you to do, and then you do your rewarding activity. You know, the other one is the idea of balance. You know, in our day, of course you need time to relax and chill out, but the dishwasher also needs to be unloaded, and you're a really important part of our family. So after you unload the dishwasher, after your homework's done, take some time for yourself. Go do what you want to do.
From Maria Gonzalez, how can we help a mom that feels guilty because she needs to work and not be home with her kids?
Oh, that's Kim.
That's me?
That's you, Kim.
That is,
because I've worked with a lot of moms who felt really guilty before. What I want to say, if you can hear my voice, if you're the mom that's feeling guilty, or if you're looking at my face, is that there are very few themes that cut across all the appointments that I've had, you know, so many interactions that I've had with friends, with family members. But the beginning, it's so common that people feel guilty. And what I understand guilty to mean is that they feel like they did something wrong, and they're feeling that way about themselves. So a lot of what I do is I try to have, you know, both of us like step outside of our bodies and look in on the situation, like we're observing, and we're trying to look at the situation and see, you know, thinking about all that's going on and thinking about all that you're doing, did you do something wrong? And in so many situations, people are doing the very best they can with what they had at the moment. And so, you know, I hope that mom, if it was someone you know, or if it was you, that they can just step outside, think about it like you're observing like another person. And so I found that can help people be kind to themselves.
I think making a list of what you actually did that day, because I know a lot of the times you feel like with work and all the things that you already do in your normal routine when you get home with your kids isn't enough. But if you take Dr. Morrow's approach of sitting back and looking at it from a separate perspective, you can see that you actually did accomplish a lot. And again, it's almost like kind of lowering that parenting standard, right? Like lowering that expectation of like, I have to be perfect mom, perfect dad all the time. Because these are very trying times.
And it's also helpful to talk to your kid, talk to them and say, I know I'm not here as much as maybe you want me to be. And explain why, explain that does make you sad. Maybe that'll help alleviate some of the guilt by trying to talk to the kid or trying to talk to whoever is in your household about your feelings, right? Again, that gives that opportunity for modeling about talking about your feelings in a positive way and making sure that you're getting your needs met as well as the kid.
There's another.
Go ahead.
I was going to say, were you going to mention something, Dr. Caproni?
No, I was going to another question, but go ahead if you wanted to
I wonder
say
if we're
something.
looking at the same one. So what suggestions do you have for creating structure and routine for kids whose parents work and are home alone during the weekdays? Parents aren't home to implement and ensure daily activities, routines are completed. And that could be very frustrating and tough when you're not there to watch over or make sure they're doing certain things. But I think one of the things that would be a good idea is to sit down with them maybe on the weekend or when you do find time to create that roadmap together, to make it collaborative and include the things that they need to do, maybe for school, chores and things like that, but also have them include things that they want to do or activities that are important to them throughout the day. So there's that balance. And then of course, use rewards, use the things that they want to do, and whether it's screen time or going somewhere, even though there's not many places to go now, but use that to your advantage too. When you are checking in with them at the end of the day, maybe have a look at their agenda or the assignments that they completed online, and you guys can sit and look at those things together and maybe talk about different barriers that the child is facing when they are home alone. To not be able to complete certain assignments and things like that, so that you're really working as a team.
Yeah, and here I think technology is your friend. You can use screen time to really adjust the settings so that they're having limited time on the apps that are time wasting, or able to block those websites that you feel are not contributing to their goals until you get home. And then you can, give them access. You can change the Netflix password in the morning so they cannot access it until they show you that they've accomplished what they need to do. And then you can give them the new password.
Yeah.
Okay, we have a few more questions I'd like to get to. Joanne Wallace is asking about how to help adults stick with taking care of themselves. And I think the perspective that you heard us talk about in terms of the oxygen mask and the plane metaphor is really important. We lead best by example, and I can't tell you, how often and how difficult that is for us to do as parents. But I think the more we emphasize that this is not a self-sacrifice contest. We have to be whole somewhat in ourselves before we can be there for our kids.
Right, and there's a lot of that, talking to the people around you about the time that you need. I know for me, it's hard sometimes to stick to a self-care schedule and giving myself the permission to maybe just have a day where I don't do any work or I don't do anything and I don't get anything done. And then that berating comes in later of like, well, you should have done this, you should have done that. And it's like, again, we all have to remember we're not just working from home. We're trying to do everything that we normally try to do while there's a pandemic going on, right? And so talk to the people around you about what you need, and honestly, make a list. So in that schedule that you make, on my list of things for the day, it'll say from 12 to 1, sit on couch. And I mean, it seems almost ridiculous, but when I have it written down and then I just go and I do it, I just make sure that I stick to it, because I know if I don't, I'm going to suffer later. We have, like Dr. Caproni said, we have to put on our own mask first. And I know that that can be challenging, but we have to try. And it's kind of try to schedule your self-care time at the same time as maybe the kid has the 30 minutes on Audible or the 30 minutes on Netflix while you have the 30 minutes in your room maybe listening to some calming music, maybe stretching, doing some yoga or doing whatever, but it's really giving yourself the permission, I think, is really where we all get into a lot of trouble, is not allowing ourselves to have that time.
And really being kind to ourselves and coming from that non-judgmental standpoint and letting ourselves engage in things that are going to help us give strength to our children, because you cannot give strength when you don't have your needs met.
Right.
I think we have time probably for one more question. This is a difficult one. This is from a mom of 2 teenagers who are miserable in this process. One is a senior and has basically had a lot of losses in terms of the shutdown of their school. We're talking about this just today in terms of how to handle graduation. Schools are talking about virtual graduations. I just heard that our NSU University School is doing some kind of a drive-by graduation where they're throwing diplomas into the car as it goes by. I hope I'm not saying this wrong, but
No, that's right.
I love that idea.
I think a creative approach, and you know, I think it's 2 sides of a coin. On one hand, we can't candy coat the idea that this is tough. You know, there are losses, there's sacrifices we're going to have to make. But somewhere embedded in those adversities are also opportunities that we need to also focus on. So you can't play one side without the other.
Yeah, I think also, I mean, I've encountered this situation just within my clinical work of people that are seniors in high school that are trying to adjust, and, you know, they're missing out on proms, they're missing out on all of these really important milestones that we all got to go through, and now they're not. And so something that you need to find is something, for example, there's something called the Good News Network with John Krasinski, where he held like a virtual prom, right? And so we have to get kind of creative here with about what we're doing with people that are kind of feeling disengaged and not wanting to do work, because that's happening with everyone, not just high school students, but college students. I have found my patients are just like, I don't have any motivation to do this.
Mm-hmm.
So it's about creating that schedule, right? And trying to encourage them, get on Google Hangouts, get on Zoom with your friends in between your classes, try to get them to engage more socially. We're all social beings, and being told to stay in our house for months at a time, it's not normal. It's not evolutionarily okay for us to do this. And so really encourage them to reach out to each other, have these virtual Hangouts. There's Netflix parties that you guys can all log on to Netflix and watch the show at the same time. And so I think maybe encouraging them to do that more and have that social contact will really help balance out the schoolwork too and make it feel a little bit more normal.
I'm sorry, I wanted to say, for those of you that have asked questions that we haven't been able to get to, keep in mind that a lot of private mental health practitioners are online, are providing telehealth services. Here at Nova, we have an extensive clinic program that is in the process now of looking at how we can start telehealth services very soon. So while you're still at home, while you're still locked down, there are still some mental health services available there if you feel that, you know, you're in need. Carlos, if you'd like to take over and specify how our participants can access the recording. I think you did already here.
Great. Well, first of all, thank you all for a very interesting program. Big round of applause for our panel. I did just send everybody the web address, and I'll send it one more time. Please tell your friends. nova.edu/sharkchats. 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 We are Nova Southeastern University. We're in Fort Lauderdale, Davie, Fort Lauderdale. We've also got campuses around the state of Florida and Puerto Rico. And we have a number of programs online. I teach in the College of Education. I work for the College of Psychology, and I teach in the area of human services. So come on into my classes. That'd be fun. And we're really excited that you joined us. We had over 600 individuals that had signed on for most of the program. And we are going to end our recording right here. Any final last words?
Thank
Everybody
you so much.
Thank you, everyone. Be safe out there.
Be safe, be well. Thank you, everyone.